Jimmy Bishop founded his company, Bishop Electric, when he was just 23 years old. Now, decades later, Bishop was nearly forced to call it quits because of debilitating pain in both knees.
It was, on a 1 to 10, it was a 10. I couldn't get it to quit hurting at night. I'd lay awake at night. I couldn't get it to ever just go away.
Bishop could barely work at the company he built from scratch and had virtually abandoned his lifelong hobby, muscle cars.
6 Mustangs, a 50 model Ford panel truck, and a 48 two-door Chevy coupe. Mustang nut, I love them.
The pain in his knees made getting in and out of the cars impossible.
I couldn't drive the cars with my legs hurting because the Mustangs were slow and hard to get in and out of, and the panel truck and the Chevys all had clutches, and it just got to where I was parking them and wasn't driving them anymore.
Bishop even considered selling the fleet until he found adult reconstructive orthopedic surgeon Dr. Paul Jacob.
Mr. Bishop's an interesting character. He came to me probably 10 years too late, so he has significant deformity on both of his knees.
Dr. Jacob's team started with Jimmy's right knee. The surgery was a great success, and Bishop's relief was immediate.
The day after surgery, I offered to hug him. It felt so much better. I have no pain in my right leg at all. My left leg still hurts constantly.
3 months after the surgery, Jimmy's right knee is fully healed. He's now preparing for surgery on the left knee and dreaming of zipping through life full throttle.
After we get that next knee done, he's going to be home free and hopefully not driving too fast, but enjoying his classic car collection again.
You're looking forward to a busy day today?
Danny Boyle had also reached his limit with knee pain. Boyle is the owner of Country Boy Markets, and like so many who struggle with joint pain, Boyle can trace his difficulty back to a childhood injury.
I hurt my knee when I was a young man playing softball. Blew it out, cartilage gone. Back in those days, they just took the cartilage out. In the last 2 years, I've had a real problem because it just become bone on the inside of my right knee.
He had a pretty common problem, which is isolated medial compartment arthritis of the knee. And that's something we see quite often. And really, he had a partial knee replacement.
We get trucks 3 days a week.
It's significantly less trauma associated with doing that surgery, and so they recover quicker. They can go home same day. They really don't have a requirement for overnight stay in the hospital.
In no time, Boyle was back in the store, walking the grocery aisles just a few days after surgery, quick to brag to customers and vendors about the great service he received and his speedy recovery.
I got there at 5:30. They did the surgery at 7, and I was home by 2:30.
Trained at the world-famous Cleveland Clinic in Ohio, Dr. Paul Jacob specializes in adult knee and hip joint reconstruction. An experienced surgeon, Dr. Jacob is also certified in physical therapy, a rare and valuable combination for his patients.
Having had the best, what I feel is the best training in the world, really set me up well to do really remarkable things for my patients. And we do several different approaches to total knee and partial knee replacements, from minimally invasive subvastus approach to a mini mid-vastus, and we have every option all the way up to big open medial parapatellar exposures.
2 patients, 2 kinds of knee replacements, both with the same marvelous results. Back to life, full speed ahead.